And tonight we're taking a deeper look at how gun violence is taking a toll on not just our communities, but medical providers. News 8's Bob Wilson has that story.
Firearms are the #1 cause of death for our youth.
When a person is shot in Hartford, St. Francis is one of 2 large trauma centers in the city. They share the load of the gunshot patients.
It is taxing on the entire medical staff, from everyone who works in the emergency departments, the operating rooms, the surgical floors, every single person it touches violence in that way, and it wears on everybody.
Today, the country's top doc calling gun violence in America a public health crisis, stressing out the communities, stressing the hospitals, and he's hoping lawmakers will do much more than just talk about it.
We need real action to ban assault weapons, provide for better liability on the part of the gun manufacturers, red flag statutes.
And while Connecticut leads the way in gun laws, the doctors in the hospitals and the ERs are doing their best to help gunshot victims before they are released back into the same environment where they were shot.
We have staff who will meet bedside with families and with kids to talk to them about what happened and help them through that whole process of recovery.
At Connecticut Children's, they see gun violence in young kids and teenagers and have a hospital-based violence intervention team.
What we know about intervening, whether with adults or children at the time they're shot, this is called the golden hour, the moment when people who've been shot are likely to accept help.
Reaching out to the community for education and teaching Stop the Bleed to our community members, our schools, all the things that we try to do to educate and prevent some of the violence from happening.
And Connecticut Children's says next month, $2 million in Department of Public Health grant money will be available to community organizers to help with gun intervention. In Hartford, Bob Wilson, News 8.